Medicare Supplement Plan G gets advertised as the best Medigap plan. In this video, we are going to take a look at whether or not that is really true. First, let me say there is no one-size-fits-all Medicare plan. Any marketing or salesperson who says that one plan is the best fit for every Medicare beneficiary should be questioned. In this video, I'm going to show you Medicare Supplement Plan G costs and coverage and teach you how to figure out if Medicare Supplement Plan G is really the best option for you. Hi, I'm Tabitha Moldenhauer, Medicare Plan Broker with Benefit Consultants Midwest. If you haven't already, please take a moment to hit the subscribe button. For personalized help with your Medicare questions, please see the description for contact information. Medicare Supplement, also known as Medigap coverage, is standardized by law. So a Plan G from any insurance company will have exactly the same benefits. Medicare Parts A and B are your primary health insurance. Medicare Supplements are secondary insurance. With standard Medicare Supplements, there are no networks, so you are free to see any doctor or medical provider who accepts Medicare. Plan G is the most comprehensive Medicare supplement that can be purchased by anyone who enrolled in Medicare on or after January 1st, 2020. Here's a coverage chart for all Medigap plans. You can see that Plan G has more coverage than any other except for Plan F and Plan C. Plans F and C are still available, but only to people whose Medicare Parts A and B effective dates are before January 1st, 2020. Honestly, it's not in anyone's best interest to enroll in a Plan F or a Plan C, even if you are eligible to do so. For more details on why that is, please see the video linked above. Let's look at Plan G coverage. For all medical care covered by Original Medicare, that's Medicare Parts A and B, your out-of-pocket risk with a Medicare Supplement Plan G is limited to the Medicare Part B annual deductible. In 2022, that deductible is $233. If you reach that deductible, all covered outpatient expenses beyond that are covered at no cost to you. The cost is split between Medicare Part B and Medicare Supplement Plan G. This includes things like office visits, diagnostic testing, outpatient surgery, chemotherapy, and all other outpatient treatments. On the inpatient side, all covered expenses are covered between Medicare Part A and Medicare Supplement Plan G. You have no out-of-pocket costs for covered inpatient care. This is one of the reasons why Medicare Supplement Plan G gets advertised as the best. It's the most comprehensive. It has the most coverage and the least out-of-pocket risk to you. But there are trade-offs for that high level of coverage. Because Plan G is the most comprehensive coverage and the lowest out-of-pocket spending risk for you, it does have the highest cost in terms of monthly premiums of all of the Medicare Supplement options. Since Medicare Supplement prices generally go up once a year as you age, we need to think about future costs and rate increases in addition to the initial cost when you first apply. Plan G is more expensive when you first enroll, and you can expect yearly increases in the premium to be more with a Plan G than with, say, a Plan N or a high deductible Plan G. Rate increases are partly based on aging and partly based on how much the insurance company pays out in claims every year. Every insurance company will pay out more in claims on Medicare Supplement Plan G than they will for other Medicare supplements. So across the board, Plan G rates will have higher percentage increases. Let's look at some of those premium costs. For 65-year-olds, Plan G is somewhere between $100 per month and $150 per month in most states. Every state has slightly different laws for Medigap plans. We're going to look at the averages. If you live in a state that is a real outlier and has very different Medicare supplement laws, your costs could be significantly higher. For most states, though, at age 65, you're looking at a premium for Medicare Supplement Plan G of somewhere between $100 and $150 per month. Let's also look at Plan N, which is one step down in terms of comprehensive coverage from Plan G. Plan N monthly premiums are somewhere between $75 per month and $130 per month at age 65. So not too much difference there. However, we also have to look at rate increases. In the past 5 years, Plan N rates have risen by about 2% per year. Plan G rates have risen by closer to 6% per year. You can expect a small age increase every year and a percentage increase based on how much the insurance company paid out in claims for people in your area who have the same Medicare Supplement plan and purchased that plan at about the same time that you did. Rate increases are always based on the claims experience of a group of people, not on any one particular person. You cannot be singled out by your Medicare Supplement company for a rate increase, no matter what your medical expenses may be. Once you've been on Medicare for several years, the difference in premium cost between a Plan G and a Plan N becomes pretty significant due to those rate increases. Plan G still might be the better option for you, but it's important to be aware when you're first purchasing that those rate increases are coming and use that in your calculation to make a decision between Plan G and Plan N. Is Plan G a good choice for you? If you have very expensive ongoing treatments like chemotherapy, treatment for rheumatoid arthritis, diabetes, or any other medical condition that needs regular and costly medical treatment, a Plan G can be a good choice for you. That higher monthly Plan G premium is balanced out by the savings in out-of-pocket costs because you don't have any high deductibles or copays that you need to pay. If you want the peace of mind that your out-of-pocket risk is capped at the very low level of that Medicare Part B annual deductible of $233, and if your budget can handle the higher Plan G premium and future rate increases, Plan G can be a good choice for you. If you are pretty healthy and don't make many office visits during a typical year, it's worth taking a look at Plan N or even high deductible Plan G in addition to Plan G. Enrolling in a Plan N or a high deductible Plan G can save you thousands of dollars in premium payments during your time on Medicare. More details on the differences in coverage and cost between Plan G, Plan N, and high deductible Plan G can be found in the video linked above. You aren't locked into any Medicare plan forever. So if you decide to change to a Medicare Supplement Plan G or away from your Medicare Supplement Plan G down the road, you usually can. Most Medicare Supplement companies do require that you answer some health questions as part of the application to purchase a new Medicare supplement once you've been on Medicare Part B for more than 6 months. But there are exceptions to that general rule. And Medicare Advantage plans never require health questions to enroll. As your health or your life changes, it's a good idea to reevaluate your Medicare plan coverage to see if there's another option out there that might be a better fit for you. Why is Plan G marketed so much? Plan G is an emotionally reassuring option because it has such a low out-of-pocket risk. And the premium cost isn't terribly high when a person is first looking at Medicare plans around age 65. If an agent or broker never tells you about future premium increases or calculates out how much the insurance company is likely to pay out for your claims versus how much you are going to be paying the insurance company every year, Plan G can certainly seem like the best deal around. There are a couple other issues that play into the marketing push for Medicare Supplement Plan G. Because Plan G is the most comprehensive, it's very easy to explain to clients and to new agents. Some agents, especially in big call centers, are trained to only sell Plan G because it's a quick way to get a brand new agent selling. That way they learn one plan instead of dozens of options. Of course, that's not really in your best interest because it's entirely possible that one of the plans that the new agent doesn't know about is actually going to be a better fit for you. Also, agent commissions on Medicare Supplement plans are a percentage of the premium that you pay. If you are paying a higher monthly premium, the agent is making more in commission. This doesn't necessarily mean that an agent is trying to sell you something that isn't in your best interest, but always keep in mind that the more expensive plans do benefit your agent more. When you are looking for a Medicare plan agent or broker, you want to find someone who can explain and compare all the plans that are available, not just the ones that are the easiest to explain or the ones that benefit the agent most. If you have questions about your Medicare coverage, please feel free to give our office a call at 877-312-1414 or schedule your free, no obligation Medicare plan consultation using the link in the description. We objectively shop all available Medicare plans with you to find the one that really is the best fit for your unique situation. Have a great day.